one of the questions that we often hear from patients is, when should I get my upper and lower lids done at the same time? When is it okay to do just the upper or just the lower lid? Generally, we take each patient individually and evaluate them to see when each procedure is necessary. As a general rule, we tell patients that we look at the entire eye unit as a whole subunit. People look at you and they see the entire eye, not just an upper lid or a lower lid. And so that's really where the evaluation comes in.
Yeah, so in other words, if you have both this sort of heavy, tired look to the upper lids, but you also have some bagginess or fullness to the lower lids themselves, if you choose just to consider an upper eyelid lift, it will do something really nicely for you. But unless you're also addressing the lower lid heaviness and bags, you might still feel afterwards like you haven't completely rejuvenated.
Yeah, it's just one of those funny little things. Like sometimes patients come in and they got the little bagginess under the eyes, but the upper lid is much worse, or vice versa. And so the patient might be focused in on one thing. And in those instances, we'll say, hey, you really should consider doing both things. Even if it's a little bit earlier for the lower or the upper lid, it's worthwhile doing both at the same time in those instances, just so that you get a full rejuvenated look. It's just like one of those things where a patient will come in and they think they've just got a little bump on the nose, but their tip is also bulbous, and if you just take care of the bump, then you're going to notice the bulbousness in the tip, and same sort of thing with the eye. So it's individualized. We'll look at you individually for each of these procedures, but oftentimes it makes sense to do both together.